Ready for a deep dive today? We're tackling this idea of winning in healthcare and what happens when you leave some people behind.
Yeah, it's a big one.
We're joined by
The big question right now.
expert speaker who knows a thing or two about how social systems work or don't work. We're really digging into sociologist Dr. Moses Seenarine's book, Liberal Losers. You were really drawn to Chapter 8, Republican Healthcare. So let's jump right in.
So seenarine leads with this really interesting point about medical tourism. Have you ever thought about going abroad to get a medical procedure done?
I mean, I know it's cheaper,
Right.
but I haven't really connected it to the whole, conservative versus liberal debate.
And that's what's so interesting. So, the conservative argument often is like free markets, they make things cheaper, they make things more efficient. But seenarine says, look at medical tourism. This is actually like the counter argument in action.
Okay.
Because people are saying, yeah, it might be cheaper to get a hip replacement in another country, even with the travel.
Interesting.
It kind of undercuts this idea that the U.S. system, which is, very much driven by market forces, is automatically the most efficient.
It's like a real world example instead of just like theory.
Totally. And this ties into his whole critique of attempts to repeal and replace the Affordable Care Act,
Right.
which he says is like a case study in focusing just on individual responsibility and then having that backfire.
So like the people who can't afford to be quote unquote responsible.
Yeah,
Yeah.
his big example is the proposed cuts to Medicaid that were in the AHCA,
Right.
which, Medicaid helps millions of low-income Americans. It covers people with pre-existing conditions. And he's saying, look, you're undercutting your whole point about individual responsibility if you're taking away people's ability to even afford to see a doctor.
It's like pulling yourself up by your bootstraps, but someone took your boots.
Exactly. And he doesn't stop at the ACA. He goes after the conservative views on Social Security
Okay.
and Medicare.
Yeah. Those are two big ones that make people really nervous.
For good reason. So let's unpack privatization for a second.
Okay.
Which, on paper, it sounds good. More individual control, maybe you get better returns. But seenarine says, hold on. You're exposing retirees to way more risk, especially during economic downturns.
Right.
Imagine your retirement savings are tied up in the stock market and suddenly there's a crash.
Yeah. Most retirees are not going to be okay with that.
No. And then on top of that, you've got this idea of raising the retirement age.
Right.
Which he argues, listen, that disproportionately affects people who have physically demanding jobs.
Oh, absolutely.
Think construction workers, nurses, factory workers. You can't expect these people to work until they're 70.
Right.
It just doesn't work, and it just makes existing inequalities worse.
So it seems like a recurring theme here is that maybe these conservative approaches, they sound good, but they don't really match up with how people are actually living.
And that's where I think his sociological perspective is so useful. He connects these healthcare debates back to the larger issue of medical debt.
Okay.
Because he argues it's not just a personal finance problem. It's a symptom of a system that prioritizes individual responsibility over the well-being of, everybody.
Right.
Think about it. Medical debt is a leading cause of bankruptcy. It disproportionately burdens low-income households and minorities.
Yeah.
It's you can't tell people to be personally responsible and then just ignore all of the things that make healthcare so expensive in the first place. And then he dives into the mental health crisis,
Okay.
which he says is often completely misunderstood and mishandled by the conservative approach.
And this feels like this is where it gets really complicated. This intersection of healthcare and personal choice and what we do as a society.
Yeah, and this is where his argument about the limits of individual responsibility, I think, really shines through.
Okay.
He's not saying people shouldn't make healthy choices. He's saying we have to acknowledge all of these other factors, the economic factors, the social factors, that sometimes make it impossible to make those choices.
Right. It's not just about willpower.
Right? It's like poverty, lack of education,
Yeah.
discrimination.
It's like expecting someone to swim when they've never had a lesson and there's a current pulling them down.
That's a great way to put it. And I think that's the kind of nuanced thinking that seenarine is really pushing for. He wants us to move past these simplistic solutions and really grapple with how complicated these issues are.
Right.
Because they are complicated.
Absolutely.
They're very, very complicated.
So if just saying, hey, be responsible isn't going to cut it, what does seenarine actually think we should be doing?
So he's really pushing for this idea of shifting our focus away from just the individual and more towards collective well-being.
Okay.
He wants a system that helps everyone not just survive, but actually thrive.
So what does that look like? What's he
Yeah.
talking about there?
So he points to a few key areas. One of the big ones is affordable housing. Oh, it's like, look, you can't have good health without stable housing.
Right.
It reduces your stress, you have a sense of security, you can actually focus on taking care of yourself.
You're not worried about where you're going to sleep that night.
Exactly. And
Yeah.
then it goes beyond just housing, too.
Mm.
He's also really big on a living wage
Okay.
because when you're constantly stressed about money, you're more likely to put your health on the back burner.
Makes sense.
You're going to delay going to the doctor,
Mhm.
you might skip medications, you might even just buy like the cheapest, unhealthiest food because that's all you can afford.
So it's about making it possible to actually afford to be healthy.
Exactly. And then he adds to this, he says, we need better education and job training programs
Okay.
because these are investments in people
Right.
that ultimately lead to better health outcomes.
It helps people break out of those cycles of poverty.
Right. It gives them opportunities.
Yeah.
And this is where I think his critique of the conservative approaches really comes full circle.
How so?
He's saying, by focusing so much on individual responsibility, these policies, they miss these really important things that could actually prevent a lot of health problems in the first place.
It's like mopping up the floor when you've got a leaky faucet. You got to fix the source of the problem.
Perfect analogy. And this brings us back to the Affordable Care Act.
The ECA.
Yeah.
Right.
So he acknowledges it's got its flaws.
Right, wasn't perfect.
Right. But he gives it credit for expanding coverage to a lot of people and putting some important consumer protections in place.
But he doesn't think it goes far enough.
No. He sees it more as like a starting point.
Okay.
Something to build on as we move towards like a truly universal
Yeah.
system.
And this is where he's really talking about healthcare as a right, not a privilege.
Exactly.
Yeah.
He's saying, look, it shouldn't matter how much money you make or what your job is.
Healthcare should be for everybody.
Everyone, just like education, just like public safety, it's a fundamental right.
Which I'm sure puts him in direct conflict with people who see it as something you buy and sell on the free market.
Oh, absolutely.
Right.
And this is where the debate gets really, really heated.
Yeah.
Because he's asking us to really look at our values.
Our priorities.
Right. Like, are we willing to put the well-being of all citizens first, even if it means the government has to step in a little bit?
Redistribute some resources.
Exactly. And that is a question that goes way beyond just healthcare.
It's about what kind of society we want to live in.
Exactly. And so how do you address the people who say, well, a universal system would just be too expensive?
Right, that's the big argument.
Right. But he says, actually, our current system is already incredibly expensive.
Okay, how so?
He says we rely so heavily on private insurance, there's so much administrative waste that it's actually less efficient than a single-payer system.
Interesting.
And he points to other developed countries that have universal health care, and their costs are lower and their outcomes are better.
Okay, but those countries are so different than us.
They are, but it makes you wonder why we can't figure this out.
Right, we have so many resources.
Then he says a big part of it is political will. He thinks the healthcare lobby has been very effective at blocking any kind of real reform.
Because they benefit from the way things are.
Exactly. So it's like this huge battle, and the American people are kind of stuck in the middle.
So what can we do? It feels like such a big problem.
Well, I think that's what's so great about Seenarine's work.
What do you mean?
He's not just analyzing the problem, he's giving us a call to action.
Okay, what does he want us to do?
He wants us to get informed, get engaged, and demand a better system.
So it's about more than just healthcare policy, it's about social justice.
Exactly.
Yeah.
He sees access to quality healthcare as a fundamental human right.
And you can't have that without changing the whole system.
Exactly. It requires a shift in our values and our priorities as a society.
Well, this has been incredibly eye-opening. I feel like you've given us a whole new way to think about this.
Well, that's what Seenarine's work does. It challenges us to look beyond these really simple explanations and really grapple with how complex this all is.
So we've talked about the individual responsibility thing, but it feels like Seenarine wants us to dig even deeper than that. Like, look at the values underneath it all.
Yeah, he's saying there's this whole framework at play, like conservative approaches often see healthcare as this thing where it's all about personal responsibility,
Yeah.
Individual choice, free markets, all that.
Which, again, sounds good in theory, but we've been talking about how that doesn't always match up with reality.
Right, and that's where he introduces this idea of liberal losers.
Liberal users.
Yeah.
Okay, I'm not sure I follow.
So it's this idea that when you're always focused on like who are the winners and losers in a system, you miss the big picture.
Okay. And how does that apply to healthcare?
He's saying that when you make it all about individual choice and market forces, the people who already have advantages, they're the ones who benefit the most.
So people with more money, better jobs, fewer health problems to begin with.
Exactly. And the people who are already struggling, they get left behind.
It's like this cycle where The rich get healthier and the poor get sicker.
Pretty much.
Yeah.
And he says this isn't just bad for those individuals, it hurts the whole system.
Because we all depend on each other.
Right. Like if a huge chunk of the population is unhealthy, it affects everyone. Productivity suffers, social services get strained, poverty continues. It's like a domino effect.
So this is where his argument for a collective approach comes in.
Yeah, he's saying when we invest in the health of all citizens, it's not just some act of charity, it actually makes us stronger as a society.
So it's not just the right thing to do, it's the smart thing to do.
Exactly. A healthier population is more productive, more innovative, and ultimately more just and equitable.
Which benefits everyone in the long run.
A win-win.
This has been amazing. I feel like Seenarine is really challenging us to rethink this whole idea of healthcare.
Yeah, he wants us to move away from this narrow focus on individual responsibility and really embrace a more holistic approach, something that's more compassionate and honestly more effective.
So it's about seeing healthcare not as something you buy, but as a fundamental human, right?
Yeah, exactly.
Something everyone deserves.
And that's a pretty big shift in thinking.
It is. It's
Yeah.
about recognizing that we're all connected, that we have a responsibility to care for one another.
Well said. And on that note, I want to thank you so much for joining us today for this deep dive into liberal losers. This has been eye-opening.
It's always great to be here and have these conversations. And to our listeners out there, we hope this has given you a lot to think about. Remember, knowledge is power. Keep asking those tough questions, keep learning, and keep the conversation going.